Diabetes mellitus is a condition where blood sugar regulation is impaired due to problems with insulin. Insulin is the key that allows glucose to enter cells for energy. Today, we'll learn type 1, type 2, and a dangerous complication, diabetic ketoacidosis, with all the nursing teaching you need to know. Type 1 diabetes mellitus, T1DM. Type 1DM is an autoimmune disease where the body destroys insulin-producing beta cells. This leads to no insulin production. Glucose can't enter the cells and builds up in the blood. Key points: usually diagnosed in children or young adults. Rapid onset of symptoms. Classic symptoms: mnemonic 3 Ps plus W. Polyuria, frequent urination. Polydipsia, excessive thirst. Polyphagia, increased hunger. Weight loss despite eating. Complications to watch: risk for DKA. Long-term neuropathy, retinopathy, nephropathy, cardiovascular disease. Nursing teaching for T1DM. 1. Insulin therapy. Correct type and timing. Basal, bolus. Rotate injection sites. 2. Blood glucose monitoring. Frequency, technique, documenting readings. 3. Hypoglycemia recognition and management. Signs include tremors, sweating, confusion. Teach use of glucose tablets or glucagon. 4. Diet and carb counting. Balanced meals, snacks for insulin timing. 5. Exercise education. Monitor glucose before, after activity. Adjust carbs or insulin as needed. 6. Sick day rules. Continue insulin, monitor glucose, ketones, stay hydrated. 7. Foot care. Inspect daily, avoid barefoot walking, proper footwear. 8. Prevent infections, vaccinations, skin checks. Type 2 diabetes mellitus, T2DM. Type 2DM occurs when the body is resistant to insulin or the pancreas cannot produce enough. It develops gradually and may remain undiagnosed for years. Risk factors: mnemonic obese, obesity. Blood pressure, hypertension. Ethnic background, sedentary lifestyle. Elderly age. Symptoms: often subtle, fatigue, blurred vision, poor wound healing, recurrent infections. May eventually develop classic 3 Ps. Complications: macrovascular, coronary artery disease, stroke, and peripheral artery disease. Microvascular, neuropathy, nephropathy, retinopathy. Poor wound healing, infections. Nursing teaching for T2DM. 1. Lifestyle modifications: low fat, high fiber, low glycemic index diet. Weight loss, moderate exercise. Avoid alcohol and smoking. 2. Blood glucose monitoring. Teach technique, target ranges. 3. Medication adherence, oral agents, metformin, etc. Insulin if prescribed. 4. Hyperglycemia recognition, 3 Ps, fatigue, blurred vision. 5. Prevent complications. Foot care, daily inspection, protective shoes. Eye exams, annual retinal checks. Manage hypertension, hyperlipidemia. 6. Sick day rules. Continue medications, monitor frequently, stay hydrated. 7. Stress management. Stress can elevate blood glucose. Diabetic ketoacidosis, DKA. DKA is life-threatening, usually in type 1 DM, and sometimes type 2 under stress. Without insulin, the body burns fat for energy, producing ketones that acidify the blood. Causes: missed insulin doses, infection or illness. New type 1 diagnosis. Symptoms: mnemonic DKA, dehydration, fruity breath. Kussmaul respirations, deep rapid breathing. Abdominal pain, nausea, vomiting, lethargy. Lab findings: blood glucose greater than 250 milligrams per deciliter. Positive serum and urine ketones. Metabolic acidosis, low pH and bicarbonate. Pseudo-hyperkalemia. Nursing priorities and teaching. 1. Fluid replacement, IV normal saline to correct dehydration. 2. Insulin therapy, IV insulin to reduce glucose and ketones. 3. Electrolyte management, monitor potassium closely, replace if needed. 4th, monitor vitals and cardiac status. hypotension, tachycardia, dysrhythmias. 5. Ongoing education. Prevent recurrence. Monitor glucose. Recognize early signs. 6. Transition to subcutaneous insulin once stabilized. Type 1. No insulin. Insulin therapy required. Type 2. Insulin resistance. Lifestyle plus meds. DKA. Medical emergency. Fluids, insulin, electrolytes. Nursing teaching is critical. Glucose monitoring, medications, diet, exercise, sick day rules, foot care, and complication prevention. With proper understanding and care, both patients and nurses can manage diabetes effectively and prevent serious complications. For more content, follow us on TikTok, YouTube, and Facebook at Visual.Nursing.